Mr.
Chairman, thank you for holding this hearing. Mr. Cummings, thank you for your comments. This is certainly a scourge that is affecting everyone. In my community, I was touring a brand new hospital, Soin Medical Hospital, and was taken back to a conference room to meet with the leadership of the brand new hospital and ask them what is their most significant challenge. And they told me babies being born addicted to opiates. Now, brand new hospital, out of all the federal regulations about all of the funding issues that they would have, you would not have thought that the biggest challenge a brand new hospital was having was babies addicted to opiates. Mr. Botticelli, thank you for all of your efforts. I appreciate your leadership. I think you're doing a great job, and appreciate your advice to Congress as to how we might be able to formulate our to-do list. Mayor, I'm a former mayor. Thank you. You live in your to-do list, and so thank you for your representation of your community. Ms. Inamoto, I'd like to put up a few slides that come from your fiscal year 2017 congressional budget justification. The first one being a quote that says that approximately 1 million Americans need but do not access treatment for an opiate abuse disorder. Again, these slides come from your fiscal year 2017 congressional budget justification. Ms. Inamoto, when we hold these hearings, we don't do them just merely for increased community awareness. We do them for a congressional to-do list, but also for an agency to-do list. So that's why I'm turning to your budget justification. We know 1 million Americans need but do not access treatment. The next slide. For example, more than 80% of state prisoners, 72% of federal prisoners, and 82% of jail inmates meet the criteria for having either a mental health or substance abuse issues. Staggering numbers. 80% state prisoners, 72% federal, 82% of jail inmates, a mental or substance use issues. Next slide. Studies show, again, your budget justification, Ms. Inamoto, studies show that only 8.3% of individuals involved with criminal justice system who are in the need of substance use disorder treatment receive it as part of their justice system supervision. Ms. Inamoto, after I left that hospital, I then began the quest of trying to find out in my community, where are the resources? How can we find resources to provide treatment? In our criminal justice system in our community, I was introduced to people who are struggling to try to provide treatment to those who are incarcerated. And then I was introduced to a prohibition in your agency's funding that prevents it from being utilized for those people who are incarcerated. So in your very agency's documents, it indicates that the problem, we have, a self-sorting, right? We have people who present themselves in the criminal justice system with this problem. We have an understanding that without treatment, they will not be able to transition. And we will, as our chairman has said, once again be providing assistance to them in either an overdose situation or see them again in the criminal justice system. And yet in your funding, there is an exclusion that prevents communities from using dollars that they receive from you to actually address that for people who are incarcerated. And to Mr. Clay's comments, in Medicare, Medicaid, there are also similar exclusions that prevent people who are entitled to receive their treatment from receiving that treatment. I have a bill, HR 4076, that would eliminate those restrictions, that would say this is funding that's already there. It's not an increase of funding, although I am for increasing the funding, but this is funds that are already there that would just allow those people to receive it. Now, Ms. Inamoto, your agency, by rule, could eliminate that restriction. Why don't you?
I think the issue that you've pointed out is clearly so important to communities all across the country. We know that people in our jails, in our prisons, are overrepresented with mental illnesses and substance use disorders, and getting them adequate care is absolutely important for this nation. At the same time, we strongly support approaches such as drug courts, early diversion, as well as reentry programs, and we've made significant investments to ensure that evidence-based—
Ms. Inamoto, I appreciate all that, but before we completely lose my time, could you please tell me why your agency won't waive the requirement and allow your funding to be able to be utilized for those who are incarcerated who need it most?
You know, I want to make sure that I get you an accurate answer to that, so happy to follow up further, either for the record or in person.
Excellent, and I do appreciate your hard work. I know you're trying to assist us also, and I would encourage members to please co-sponsor 4076 because it would help the agency have the momentum to waive the prohibition themselves. Thank you.